Regarding immunity, global health is good news for corona patients. A senior WHO official said. A British study concluded that those who contracted COVID-19, they are not likely to be infected again for at least 6 months. He described the result as good news that also gives more hope for potential vaccines to prevent the disease. This is really good news, WHO chief emergency expert Mike Ryan told a news conference. To see stable levels of immunity in humans so far, it also gives us hope with regard to vaccines. Maria van Kerkhove, who is leading the WHO's technical efforts to combat COVID-19, said. We still need to follow these individuals for longer periods of time to see how long immunity lasts. A Reuters tally showed that more than 57.06 million people have been infected with the emerging coronavirus worldwide, while the total deaths resulting from the virus reached 1,365,111 cases. And hive infections have been recorded in more than 210 countries and regions since the first cases were discovered in China in December 2019. And U.S. Health Secretary Alex Azar announced, Friday, about Pfizer and BioNTech submitting an urgent license application for their novel coronavirus vaccine in the United States. Adding that the American company Moderna, which is also working to develop and distribute an anti-corona vaccine on a large scale, she had made a similar request. For her part, the President of the European Commission, Ursula von der Leyen, announced that the Union could give the green light to start the circulation of the two vaccines as of the second half of December, if the necessary measures are taken without problems. The Pfizer-BioNTech alliance and Moderna said in recent days that their vaccines are 95% effective, which was enough to inspire optimism in the world, as governments have already reserved their quotas of millions of doses. The physician Anthony Fauci, who is highly regarded at the scientific level in the United States, confirmed. The speed of the vaccine development process has not undermined its safety, nor its scientific integrity. It is reported that the epidemic in the United States has entered a phase of steady acceleration, with about 200,000 injuries and 1,750 deaths recorded in the country within 24 hours. The day after 2,000 deaths were also reported, a threshold the country has not crossed for months. Americans have been called to refrain from traveling during the Thanksgiving holiday on November 26. It is an occasion where families gather in the United States and where airports and roads are crowded. And local officials across the country imposed new restrictions in order to contain the spread of the virus. On Friday, India crossed the 9 million epidemic infection mark and officially recorded more than 132 deaths. But it is feared that these figures are slightly underestimated, because not all cases were reported, and relatively few tests were performed. On Friday, the World Health Organization recommended that remdesivir not be prescribed to hospitalized COVID-19 patients. She said that this drug is very expensive and has many side effects. It does not prevent death or dangerous symptoms of corona disease. Meanwhile, the World Health Organization has welcomed the decline in the number of daily infections in Europe. During the past week it increased by 10%, but deaths continue to rise and caution is present.